that's where it's like these incentives align between patients and providers, where it's like everyone wants that call to be successful, and that someone and we've always seen that. We've always thought about it that this is maybe the only time that someone calls. Like it might be someone's worked up the courage to call, and then if they call and get told like, oh, you can't come here because you have the wrong insurance or you don't have insurance, that can be it for that. But they might not try again. They might be like, oh, well, I tried.
Welcome back to MasterMined. I'm your host, Mark Scrivener, and as always, I'm joined by my two fabulous co-hosts, Jeff Skillen. Welcome to the show today.
It's a beautiful day in Nashville, Mark. Great to be here.
Great to have you. And Lee Pepper, thanks for being a part of this.
Thank you, and I just want to let the audience know I do have the iced Barcelona here in my mug this morning, so if I feel if I sound a little bit amped up, blame it on the iced coffee.
I've never seen a dollop of whipped cream so big in a coffee drink. I'm a little disappointed in that I thought you were a much healthier person.
I know. This is the only time I can have these drinks is when Jennifer is 30 minutes away, and she possibly won't know that I've had it.
I'm expecting Craig to put in a little EDM music bump when he talks about Barcelona. So it's like I'm expecting that in post, all right?
You know, guys, listen, I'm excited about this episode. Today we've got Ben Camp. He's the CEO and co-founder of Recovery.com. You guys are a platform I know that helps people find treatment when they need it and gets them to the right programs. So, Ben, thanks for all you do in the industry. Great to have you on the show today. So thanks for being a part of it.
Yeah, thanks for having me. And like you said, it's a beautiful day in Nashville, nice and sunny. We came into your amazing office, which is this retrofitted church. I had no idea. I was like pleasantly surprised just seeing all of that.
So what did you expect, Ben?
I don't know. I've been to some podcast studios that are just kind of in some dingy, like kind of weird place that and actually ours, I mean, we have a beautiful office in Madison, but our podcast studio is like in the basement. Like you have to kind of like go through this like weird section of the building. So,
I mean, we didn't have you pull up to a storage unit, like set it up in like, the Storage Wars kind of situation.
Well, Ben, as we were doing some research, I saw you were in Madison. It's where the company is. And, that was actually the very first Ironman that I did was up there. Loved the city, loved the views. It was just so beautiful. And people are very, very nice up in Madison.
Yeah, I think we live up to the Midwest nice thing. I forget about it. I remember one time my mom visiting, and just after she was telling one of her friends, she's like, people are so nice. Everyone was just being nice. I'm like, you forget about it. I'm originally from New England, so we're not necessarily known for being nice out there. So,
but what part of New England?
New Hampshire.
Okay.
Yeah, but I've lived in Madison now 13 years, so it's very much home. I live right on the Isthmus, and every year I get to see that Ironman. It's really impressive and nice to watch it from my balcony.
Wow. Well, Ben, as we kick it off, maybe you could just talk to how you got in this space. How'd you get in the behavioral health, the recovery space in the first place?
Yeah. Similar to you guys, my co-founder and I had a marketing agency, and we're working with a lot of addiction treatment centers and helping them, do marketing and, especially get people into their treatment center. And so we learned a lot about how to do that effectively and ethically. And, while we were doing that, I think we learned, developed a passion for kind of both sides of the marketplace. So we were working with treatment centers and seeing these people that really were like saving lives, but often like their business acumen might not be the best, or like it's very expensive a lot of times on the marketing side, and there's a lot of really good ways to waste a lot of money on marketing. And there's a lot of, we saw a lot of unethical practices and stuff. So kind of helping these marketing agencies do it the right way and build sustainable businesses that can save lives is really inspiring. And then at the same time, we are seeing the patient journey and how so much more and more of that was moving to online. That's like the first place people were going was the internet, and typing into Google, how rehab near me, or like how do I help my kid, whatever, like all these queries that you could see on Google. And so I like to say we started this company out of a bit of righteous indignation around the types of results that people were getting on Google. So back when we started the company and we're exploring this maybe like 15 years ago, we were seeing that a lot of times the results that people were getting tended to be sometimes just confusing, but often like downright misleading in the types of websites that they'd find where it might look like a legit company like recovery.com that's trying to like provide a neutral, independent resource, but really it would often be owned by a treatment center or a group of treatment centers that really what they were trying to do is get you to call this helpline and then basically talk you into going to whatever treatment center is sponsoring the hotline. So that was kind of that was the impetus for starting the company, and we knew that this field and the space deserved like a truly independent, helpful resource that people could rely on. And now we have over 1 million people every month coming to the recovery.com websites looking for treatment. We've got over 100 employees and are just hopefully continue scaling it the right way like we have been able to. So
yeah, and it was it's interesting. It was born out of an agency, which is some of the best technologies out there are typically born out of an agency. So what I guess maybe for those who might be in the audience that don't know recovery.com, maybe just do a quick overview of who you guys are. I know you talked a little bit about it, but maybe just even how it's evolved over the years and where you're at today.
Yeah. Well, we actually, I guess I'll mention like how we evolved over the years. We actually like you said, we started in an agency and it was kind of a project, and I'd imagine you guys might have some projects within the agency, and it's always like you're like, oh man, we could really do this, but it's really hard when you're trying to serve clients. Those projects always get put on the back burner. But we had this one on the back burner for a while and had started to get some traction, and we built a website serving India actually. So a lot of the websites in the U.S. had a lot of they were really entrenched SEO competitors, and it's really hard to rank on Google, where we looked in India and there was no one building any websites for people to find treatment, but there was like thousands of treatment centers actually in India at the time already. So we collected all that information, built this website. It was called deaddictioncenters.in. And that's kind of how we, I guess, cut our teeth, is just building that website, finding that information. I went to India quite a few times. We visited a bunch of treatment centers and just realized that we could add a lot of value by collecting information about treatment centers that really wasn't either accessible at all on the internet or not accessible all in one place. And so, we started doing that in the U.S. Eventually, the company, was called Rehab Path. We rebranded to recovery.com a couple years ago when we were able to get that domain. And one thing that one of our philosophies has always been to be comprehensive. So we list every treatment center, ultimately in the world for free. More than half of the calls that happen on our website are to free treatment center listings on the website. And then basically our business model is that treatment centers that want a larger reach can pay for advertising similar to Google, where they're paying on like a cost per click advertising model on the website. So,
on the domain purchase, I can't imagine what you paid for recovery.com, but I know Snapshot, when we started the company, Snapshot was available for like $15,000. And I was like, gosh, I can't pay $15,000 for the domain. And now I would love to have it, and it's about $500,000. So, yeah.
It's just snapshot.com.
Snapshot.com.
That is a good one.
Yeah. And so, anyway.
Yeah, we paid just under $1 million for the domain.
Yeah.
Which,
that's a great purchase.
I know. I think it's as crazy as how much money that is. It's very well worth it for us. So.
I mean, this is a brief tangent, but do you think the domain farming game is still a legit game out there?
I mean, people are paying big dollars for these domains. People are looking for ways to establish trust, and I think that hasn't really gone away even with AI and LLMs and everything. It's like those kind of one word or really like strong domain names, I think, still have a lot of credibility. And then it's nice for us too when we're doing like kind of real world advertising. It's memorable. So I mean, it is really valuable, and the people that had the foresight to buy those a long time ago and sit on them or whatever they've been doing with them, I mean, good for them, I guess.
Well, I mean, part of your growth strategy was the domain acquisition, right?
Mm-hmm.
I mean, so what were some of the others that you acquired to build the empire?
So we had built rehabpath.com over the years, and then we bought just the domain name recovery.com. Someone had been kind of sitting on it and not using it for a long, long time, and so we just bought that domain and then redirected our website to that domain. And then last year we made a pretty significant acquisition of a number of domains and websites, so the content as well. Rehabs.com, recovery.org, alcohol.org. There's about 7 sites that they used to be part of a company called Recovery Brands, and then they were that was acquired by American Addiction Centers back in the day, and they had decided to sell those. So we bought those last year, which really doubled our impact almost overnight, and we were able to apply kind of our philosophy to those websites, which is that it should be. We had said for the longest time, those sites, had really high quality content, but we had felt there was always this baked in conflict of interest that they were owned by a treatment center. And so, we were immediately able to kind of take that conflict of interest out, which we were really excited about.
Yeah, because when Mark was asking about, how much you paid for recovery.com, I'm like, well, they announced, in the press, it was like a $10 million plus just to get the Recovery Brands.
Yeah, the Recovery Brands was over $10 million. Yeah.
And that's what's interesting about, because, Jeff and I were in the thick of it back in the day with, recovery.com, with Recovery Brands.
Yeah.
And so it's one thing to talk about those domains, but how do you resolve that you now have all these disparate domains with content? Some of it I would argue is questionably gained, but what's the long-term path for you? How just because you're not a treatment center doesn't absolve the problems that Recovery Brand and AAC had.
Yeah, that's a great question. So, when we bought the websites, we did like a full kind of content review. And we have a clinical team that is reviewing that content. So, we've gotten rid of some of the content. We've also combined it with other content that we might have had. So, we do want to be able to put our stamp of approval on every piece of content that is out there. And I believe we've done at this point a pretty full audit on all that content that we've brought over, including a clinical review. So we brought a lot of that content over to recovery.com, like through redirects. And then I guess, we're all marketers here, so I guess we can nerd out a little bit. What we ended up doing was recovery.org, we decided there was a lot of overlap, and you want to make sure, especially on the SEO side, and you're thinking about your strategy, each website kind of needs to have a purpose. It needs to be, you don't want duplicate content, and you want it to be unique. So with recovery.org, we thought combining recovery.org and recovery.com made a lot of sense, also just from a branding perspective. So we, in November, we officially kind of pulled the switch where recovery.org now all goes to recovery.com, and it's one merged site. And we also thought from a kind of theoretical perspective on the Google side that the domain authority would be hopefully like a kind of 1 + 1 = 3 scenario, which it's proven out to be pretty well. We really saw our, even where we were ranking well with recovery.com on its own, when we kind of combined the domain authority of the two sites, saw a really good benefit for, people finding our website more.
Mm-hmm.
And then our strategy with rehabs.com is to focus that one specifically on SUD treatment, which, recovery.com is, while we have a lot of traffic coming for SUD, it's also as broad as all sorts of mental health treatment, and we want it to stay that way. So kind of, continuing to make rehabs.com really focused on SUD. And then alcohol.org we've turned into, for the most part, a meeting finder website. And we have a...
you mean an AA meeting finder?
AA, as well as all sorts of other
meetings.
NA. Yeah. Other types of meetings. And we're working with a data partner there that has really good data on that. And so we've been finding that that's been ranking really well. We've been getting a lot of traffic to that website. We're not necessarily monetizing that traffic, but it's a great at the moment. But I think we'll be able to start kind of bringing our advertisers over to there if people are looking for a higher level of care. So
right.
Yeah.
So I'm curious. And this may be obvious, but part of what we want to do is give people an opportunity just to understand kind of behind the curtain.
Yeah.
So there was a time, and the time is probably still now, where Google really sort of disfavored directory sites, right? Maybe you agree, maybe you disagree, but they were like, we really want to give authority to people who actually do the work as opposed to people who just list the directories. What is your strategy in terms of trying to address that situation? And then how do you make sure that from the search engine standpoint, one directory is better than another directory. What is your? I mean, I realize that is like super basic in terms, but it's like I'd love to hear your take on that.
Yeah, as far as Google favoring webs, kind of the provider website versus a more directory website, we have seen Google like fluctuate in that, like depending on the core update, like because we have. There's been some core updates where we've been on the kind of negative side of that, and then where we're looking at the rankings being like, okay, yeah, these treatment center websites are kind of ranking better than us, but then we've seen that in reverse too. So it does seem to kind of oscillate. I don't know who knows. It's like we have this meme of like people praying to the Google gods, like that gets passed around Slack because it's sometimes we're like, who knows what the Google gods are up to this week. And I'm sure you guys know it's just like every time there's a core update, you kind of are like, you have to tell your clients like, okay, there might be some changes. We don't know what they're going to be yet, and we'll just kind of see how it plays out. But ultimately, like the strategy on that my co-founder and our chief product officer, he kind of annoys me sometimes because he always is like, we don't do SEO. Like, we just build websites that help people and that like answer their questions. And I'm like, well, yeah, but we also have like, 5 SEO people and like we like know how to build a technical SEO website and stuff. But his philosophy so I love it because he just really beats that into our head. Like that the point is we're trying to provide answers for people's questions and like really match that search intent. And if we can do that, and then of course like there's all the technical stuff, making sure it's really fast and like looking at all the aspects that Google's looking for to make sure that that is a high quality experience, and thinking about especially the mobile experience. I mean, most of our traffic's on mobile. We've been able to just continue to rank really well. And typically, I mean, if someone's looking for like a specific treatment center like Cumberland Heights or something, the Cumberland Heights website is going to show up almost always above their profile on our website.
You hope so.
Yeah, and that's like, we're not trying to beat, we're not trying to take traffic from people that are looking for Cumberland Heights. But consumer behavior is very often people want to compare options. So someone might be like, oh, I've heard of Cumberland Heights. They type it in, and then they're like, they see their website, but then they're like, oh, actually, I want to go on this third-party website and kind of see what the reviews look like, look at other options. So, and Google's pretty good at understanding that intent as far as where someone's at in that search process. So, we tend to rank well when someone's kind of in that state of mind where they're doing a little bit more like shopping versus like they're already know where they're going, which, it's pretty typical that someone does want to look at kind of at least a few options and then see kind of especially reviews and compare the
How
different
often
options.
are you all scraping provider content? Is it every day? Is it weekly? If Cumberland Heights makes a change, how often are you scraping that and updating your site?
We rely a lot on treatment centers kind of giving us updates. We work with we have this team, we call it the research team. We have a few dozen people on that are focused on kind of a lot of those inbound updates. So if someone makes a change, like, oh, I want to update my profile, we make that change. And then we do a lot of outbound research, and of course we have like some AI tools now that are looking at the websites. I want us to be doing it more frequently. Like I think that we have over 20,000 listings. We also pull updates from the SAMHSA directory. So anytime that there's a new update from that, we're pulling. So I can't say that we have like a cadence that I can just kind of promise for the goal is to do it. I would love to be doing it every day. Actually, I think we're actually kind of seeing right now if we can do that feasibly and how much that will cost, because there's a pretty significant cost as you start doing all that kind
of your 20,000 listings.
Yeah,
how many would you say are being updated by individual providers?
I think right now over 5,000 of those listings are claimed is the status. So we have basically like unclaimed listings, which our team has just built out, and then claimed are where someone has very similar to Google My Business, where they like claim that profile and like can easily make updates. So we have like over 25% are in that claimed, which is almost like they're a customer but they're not paying us anything, where they have that relationship. So I think that's
Well, the reason I bring it up, Ben, is that's very similar to, in 2018, Congress called, a lot of people, AAC, Michael Cartwright, Jason Brown from Tree McCall's, Marvin Ventrell testified. And one of the things that came out of that testimony that has still stuck with me all these years later is that they were, AAC was trying to make the case that all their recovery brand sites, which I know you're not affiliated, you just bought their domains, but they were saying that, oh no, we've got all these providers that are participating in our free listings, but the providers did not provide it; they were scraped. And so, what is the difference in your scraping and creating these free listings versus what was going on that was pretty much debunked, 8 years ago? Why is it still happening that way?
Well, I do think that when AAC on those sites, like I mentioned before, there's that baked-in conflict of interest, and a lot of treatment centers actively did not want to participate, with what AAC was doing, and and whether it was AAC's websites or other examples, I'm not trying to like throw AAC under the bus, but there was a lot of websites that they were doing the kind of information they were collecting that information on treatment centers. And then they were doing all these shady things to, if you go on a profile page, if they're a free listing, the only phone number that you can really see, unless you really read the fine print, is the phone number for that hotline, like I was saying. So, going back to the Cumberland Heights example, it'd be like you might go to their profile on the site, and then you say, "Oh yeah, this must be their phone number," and you call, and
just classic bait and switch.
Yeah. Right. So that's definitely a difference.
Are all your listings have the facilities numbers? They don't go through you guys at all.
That's the only phone number on ours. We don't have our own phone number at all. So the only phone number is for the treatment centers, and you can actually see like.
But I'm saying it's their number. They own it. It's not a number you guys just port to them.
It's not a tracking number.
Oh, when someone claims their listing, we do a tracking number layered on top, so we can track.
See, I think
that's
happen. And I felt like that was the case because I think you and I've had a conversation a year or two ago, but I think that's one of the issues because with AAC they didn't start Recovery Brands. Recovery Brands was started by Abalash, and then they sold it. And what's interesting is once they sold it, then that's where the pressure from private equity, AAC, and now they started porting the numbers differently. So if your customers, the facilities, if it's not a number they own, what's to say in 5 years you guys just got a nice contribution from private equity? Who's to say that in 4 or 5 years they don't have more pressure to increase revenue? And all of a sudden there might be decisions, because I kind of think ultimately that's what drove AAC to do some of those tactics. Why not just put the Cumberland Heights phone number that they own and be out of that game?
Well, the only reason we do it is for tracking. So, a lot of these centers want to know how many calls are coming through their profile on recovery.com. We have dashboards and stuff like that. So, I mean, it is really like just a technical – we just do it for the technical reason of being able to track and also – knowing how all of our traffic acquisition strategies are impacting like calls.
But you would know if they click the number. You could do a pixel or something.
Yeah, it's just not nearly as exact. Because the click to calls are like all over the place. Whatever. If a treatment center didn't want, I can't think of any of definitely our paying customers all want that tracking set up. And then if any claim center didn't want that, we could take it off. It just means their dashboard wouldn't work. I think you're bringing up a good point though, in terms of ultimately the ethics behind a business are go back to who owns the business and what, and you have to be comfortable with who the owners are of that, business and it's hopefully we're providing enough value to kind of make that kind of trade-off of trust worth it, where it's okay, well, recovery.com is doing a lot of good things, we're providing a lot of value. So, but if we ever in the future do do things that make people not trust us or do things that are unethical, like we should definitely be taken to task on that.
Yeah,
for sure.
it's. I mean, Lee brings up an interesting point because I mean, like for example, if you go back into the time machine, it's like back when Netflix started, for example, it's like, I mean, I don't think anybody necessarily, when you were getting DVDs in the mail, I don't think people were necessarily thinking that someday they would be making a bid for Warner Brothers Discovery, right? And it's like, and you look at some of the decision points that they made to get to that point, and you're standing here in the present saying, oh, it makes perfect sense.
Yeah.
But, it's like, so I wonder, I mean, and Lee opened the door to that conversation. I'm curious where you want to walk through. What does that look like? I mean, so because there's so many things with the domain authority that you have that you could potentially do that maybe you're not doing now. So what are your thoughts? And now that you've brought in, equity funding, anything you want to share on that tip?
Yeah, and also another way that I might address what you're saying, Lee, is I mean, we've really tried to align ourselves to industry guidelines on like marketing guidelines because I mean, our backgrounds in marketing, like we were doing a lot of this stuff on our own, but then when the NAACP guidelines came along, we're like, this is great. Like this is exactly how we want to show up in the world and do marketing. And for the longest time, like NAACP like has not allowed us to become members because they did so much work in fighting against all these directories.
That is a ticklish relationship, isn't it?
Yeah, but we've been able to build a really good working relationship with them where we're like, hey, I think Marvin's stopping by right after this. Like we talk to Marvin like probably every quarter or so on calls, and like it's like we're an open book. We share everything that we do. And we're working on like how can we partner and help NAACP members like have better representation on our website. We're pulling in like NAACP membership as like a search, ability to search for that on our website, things like that, like as a trust signal. So I think like, we're as much as possible trying to be really transparent as to what we're doing. And, those guidelines, we really make sure that we're on the right side of them from my perspective. And that has been like a core principle. So if I think of like our growth as a company, like one of our core philosophies is just to be patient first. So, we're looking through that lens when we're building our product, when we're thinking about, so when I say our product, like the website that people are coming and looking for treatment, it's like, are we doing things that are patient first? And as that's been a really good guiding principle for us that I think we haven't really found that we felt like we've been in conflict with that, and we do try to bring accountability to ourselves, like I was saying, on a bunch of that. So, yeah, as we grow, I think keeping that top of mind is really important. So I think our main growth strategy at this point is just to continue to find ways to bring traffic to our website through a lot of I see a lot of treatment centers doing things like billboards and radio ads and all that type of stuff. Like we're working to be like, we want recovery.com to be a household name that people know that they can trust and go to and find the next step for their recovery journey, whatever that is. And then we also have this initiative around pros. We call it recovery.com pro. Like you can go recovery.com/pro. And that was actually driven by so many referring professionals saying, oh, I use your site all the time. Like I'm always looking at, because I mean, you guys know it's like, especially people that are in recovery, they're fielding calls all the time about just how to help someone in their network that they know. Or if you're actually a professional working at a treatment center, you can, a treatment center can only help, a certain percentage of those calls that come in. And the ethical thing to do is not to leave someone high and dry if your treatment center can't serve them. So our website has been becoming a really good tool for people to be able to do that. You can go on our website and like build shareable lists. Like we built it off of very similar concept to like, when you're on Airbnb and you're planning a trip and you're like adding things to your list, and so you can make different ones like, oh, this is for my Barcelona trip if you want to get more of your iced coffee things, or if you're going to
Dubai
to get Dubai chocolate, you might kind of build your list. And it sounds, obviously this is way more serious. We're talking about life and death treatment thing. But so whether you're a family member building like a list for, hopefully as someone's thinking through, oh man, I want to help someone in my family, and I'm going to put together a list of options that I think would be good for them, and hopefully that match their insurance, et cetera. Or if you're a referring professional that you're like, oh, these are the treatment centers that I would recommend for women or for adolescents, or like you can get super granular and make all those lists, and then So I think we're trying to help with kind of even on the BD side of the industry of like, there's so many. I'm sure you guys are in a bunch of them. These like text chains of, oh, I've got this client with this type of insurance, they're showing these type of symptoms, et cetera, like any recommendations. So we're trying to make that more of we're trying to help fill some of those needs that are very obvious that people have in the space that it's pretty inefficient.
Why not follow? You said a couple of interesting cases. Why not follow the Airbnb, the VRBO model, or the Psychology Today model instead of scraping and creating these free profiles? Why not allow the Cumberland Heights of the world to pay and create a profile that's different than just the scrape publicly available information? Because I know when you and I spoke a couple years ago, I was excited for the rebrand in a sense.
Right.
Of all the old stuff.
Yeah.
But that's what I'm challenging you today to say, I think that treatment centers need help with video, with social, but just scraping the publicly available and then doing the SEO game is no different than what happened 8 years ago is my challenge to you.
Yeah, I would say the scraping is just the initial pass for, I think our guiding principle around being comprehensive would, I don't have any qualms necessarily with Psychology Today, but to be on their website you have to pay, and so we feel like the way that we can best serve patients is to be comprehensive, and so if someone comes to our website, the best option might be what's the treatment center around the street, or the or the outpatient center. They might not even need rehab, like residential. They might actually be better suited for outpatient. Or maybe there is, a great detox in their town.
But you see the Cumberland Heights, and I hate to pick up Cumberland Heights, but
bring them up.
Just use ABC treatment.
ABC treatment. You see the issue where they are now on your site.
Yeah.
Somebody, and because you're so massive, and now you have so many domains, so now you're ranking 2 or 3 on the first page for their brand name. They go to read that profile, which they had no input on, or ability to even add or use your resources. And all of a sudden, they're then being presented additional options to consider, which are not serving the patient. They're potentially serving the corporate. It's a profit motive for you guys. Is the challenge for you versus saying, oh yeah, okay, well I was looking for ABC and they're just showing me people that are actually paid advertisers. Why not make it a more level playing field? And if you want to participate, pay. And we have all these resources that we can make available to you to make your center even more robust and different. That's where I really see the future for you guys to really take away the negative aspects of it.
Yeah, I think a treatment center can edit in that scenario that you were just talking about. They can edit their profile. They can, and I think even with the kind of quote unquote scraping that we do, our research team there's a lot. When people are looking at websites between treatment centers, there's a lot of just like marketing speak that's out there, and it can make it really hard to compare options. So, our research team does have a more editorial, I don't know if that's the right word, kind of editorial lens on it, where we're trying to make things a little bit more neutral and more like just kind of fact-based, like this is what they do. So we're typically taking that information. We're not just taking it exactly as it's written. We're kind of synthesizing it and making it in a format where people can compare options, which I do think is really, really valuable.
Well, you have some kind of medical review you do.
Yeah. Mm-hmm.
How is that published?
How is the medical?
Yeah. Can you read do you send a doctor or a clinician out? Like how is that
No, basically, no. Well, we do with kind of at that, like when we actually when we have a paid relationship with a treatment center, like they're an advertiser, we do have this kind of extra level of review that we do, and that's actually now our verified product. So that's kind of similar to what you're saying. It's like at that low level, like, and most treatment centers can afford it. Kind of similar to that Psychology Today pricing model, where you can become a paid subscriber on our website by this verified product, and what that includes is our research team doing that, like sending out that kind of clinical questionnaire. We often will do like a virtual tour of their facility to make sure that the photos match like what's on their website. And then that also includes LegitScript certification. So we're a partner with LegitScript, and like if you're an SUD center, we actually like will cover your LegitScript. So and LegitScript does a lot of work on making sure that these are legitimate providers. So we're kind of partnering with LegitScript to help with that.
Do you just pay for the cost, or do you actually file the paperwork on their behalf?
It's like in between. Like we pay for it, and then we're also like since we're kind of a premier partner with LegitScript, we can help in some ways to kind of help make it happen. And like, it can be a little bit overwhelming for people. So we can answer questions, et cetera. Yeah.
Ben, what I'm getting from this whole episode, though, is you started this very naturally. Like, hey, we really want to help people find the treatment. And you've built a heck of a business, grown significantly. There's still, like, as you look at the numbers, like, out of the amount of people that actually need treatment, there's a very small number that actually find the treatment. Yeah. And you're providing a resource.
Yeah.
Like, but why is it still so hard to find that treatment, do you think, out there? Not beyond even recovery.com.
Yeah. Well, I don't think we could have a conversation about it without introducing the topic of stigma, because I think that is still such a big part of it. Yeah. I think what I'm optimistic about, and probably you all are, is that I think it's better than it's ever been. On the stigma side, it's like
I think today's better than yesterday.
Yeah.
Yesterday was better than the day before. Yeah.
But we'd love to see more progress on that. And so that's definitely part of our mission, is to kind of help make it as seamless as possible and as like positive as possible to find a treatment option. I think the number one. But once someone, there's a lot of reasons why someone won't seek treatment at all. But then once someone does seek treatment, one of the big pain points is obviously financial. So that's something that we are, I think, in a decent spot to help with. And because I think, so like one of our features that we're working on right now is more of a streamlined verification of benefits kind of process. Like if you go on like ZocDoc, for instance, you can put in more of your insurance information, and it tries to filter the results based on like what insurance you can use. So so we already have insurance information on thousands of treatment centers. But that's all been like collected by treatment centers tell us like what insurance they accept. So we're trying to take a bunch more steps in that way, so that like our ultimate goal is that someone can like put in their and there's some great VOB options where it's like someone can sometimes even put in their full name and like date of birth, and it can do a lookup and like a lot of times find the plan information. So then allowing people to filter by what their actual insurance is will really help. By the time someone actually picks up the phone and makes a call, like we want, everyone. And that's where it's like these incentives align between patients and providers, where it's like everyone wants that call to be successful, and that someone, and we've always seen that, we've always thought about it, that this is maybe the only time that someone calls. Like it might be someone's worked up the courage to call, and then if they call and get told like, oh, you can't come here because you have the wrong insurance, or you don't have insurance, that can be it for that, but they might not try again. They might be like, oh, well, I tried. So,
well, I think that's the consumer behavior. They rather go to recovery.com or a rehabs, and your site is beautiful. You've got, you said 100 employees, so you guys have this amazing staff, which potentially can make it a lot easier.
Right.
Do you guys see? I'm sorry. Do you guys see potentially, like with your insurance? Would there be an API that could go to a substance use center's electronic health record, just to put that data right in so they can process?
Yeah,
I'm just asking you, is that the future?
I think that's definitely, hopefully, in the future. We're like we're a partner with Kipu, for instance, and like want to start doing more of that.
A much more streamlined pipeline, right?
Yeah.
So clearly, going back to the question about, you're starting to lay out a little bit of the future roadmap here, which to me makes a ton of sense. You're clearly carving out this space of we're the good guys, the good gals, in terms of putting a spotlight on a recommendation engine, right? In terms of pointing people towards what quality treatment, right? So let me just ask a question, because I don't know that I've ever seen this, but I'm going to ask a question. So in your mind, recovery.com was really born out of what Lee brought up in terms of the turmoil in 2018,
Yep.
and then trying to separate quality providers from not quality providers.
Yeah.
Does recovery.com or will recovery.com ever own an interest in a treatment center?
No,
Never.
never.
Okay.
Yeah.
So you're
You
going to
can pull this back, 5-10 years from now, and better not have changed.
It's on
yeah.
record
Yeah.
right now.
Well, I mean, the reason I asked that question is it's not a gotcha question.
Yeah.
It's really I want to understand the DNA, and then also what is the profit motive in terms of continuing to grow? Is it continuing to be on the third party provider side, recommendation engine side, and just getting that better and better and better so that we partner with people, or is it ultimately that we're going to try to do some sort of vertical integration play?
Yeah, I mean, I think that our motivation for growth is somewhat back to what you were saying around like how many more people are not getting help. So I think that we know, and we all in this room know, like how many millions of people need help that aren't getting it every year. And then the people that are getting help, like, they might not always be going to the best treatment option for them, and that can have a huge impact on outcomes. So I think that, we're also doing some interesting kind of partnerships, or it's pretty nascent, but like on the kind of roadmap is the partnering with outcome providers. We now have some third-party outcome providers that we do some sharing of like client lists where we can now surface, this treatment center works with a third-party outcomes provider,
And we can publish those outcomes, for example.
Eventually we want to start using that. I mean, a lot of I'm sure you all know Dan Gemp. He's was Dreamscape, and like had huge impact on the space on the marketing side. Like something he's been kind of preaching for a while that I really picked up on is like how helpful outcomes data is in marketing. And I'm sure you guys talk about that with your clients. It's like, so we want to try to do that on our platform too, so that people can, because that's what people want. Especially if you're a family member looking for help, is you want a good outcome. So so there's just so many things that I feel like we're still just scratching the surface on, that if we can, help those more people that come to our website successfully find a treatment center, and hopefully one that is going to bring a better outcome. Yeah. And then if we can do a lot of work on the kind of building an audience side and get even more people that weren't even like in the truly considering treatment, think about, I could actually, make my life better by coming to recovery.com. I feel like we have a lot of growth there. And I think that so I mean, I think that's kind of what motivates our growth, and we just have a lot of room in front of us. And then like, I think that we're really well positioned from a business side, because I mean, and this is like we knew from the outset is like how much these treatment centers are spending just on Google alone, and never mind like their whole digital advertising bucket. So I mean, we're often able to take, when we're talking to a treatment center about like whether they should advertise on our platform, it's like we ask them like, how much are you spending on Google? And then we're like, well, maybe you should spend like 20% of that on our platform. Like that's typically our pitch, is like start there and let's see how that goes, because most of the time, that last 20% you might be spending on Google is typically your least efficient. It's like typically a pretty slam dunk of like, you're just a lot of times like wasting money, or at minimum like you're not super happy with the results that you're getting on Google overall. And so, let's take some of that and put it, send it to recovery.com. And I think the good thing there, and that I think a lot of our clients appreciate, is that we are trying to make the industry better, and like, we have a mission behind what we're doing. I think sending more money to Mountain View, like no one gets that excited about it. It's like a necessary evil. So I think that's where it's like we just have so much room to grow, because if we can just continue delivering value to treatment centers that are already paying Google and Meta and all these other platforms a ton of money, if they can just start moving some of that to us, they can hopefully get better results, and then we can keep growing and hopefully have a positive impact.
You're
on
not
the
picking up
industry.
on an alliteration theme here. Money to Mountain View, but we're gonna do money to Madison now.
Yeah,
right?
money to Madison. Yeah, and everyone likes a small, Midwest city too.
Yeah, I mean, it's just like
more,
Ben, you talked about outcomes, and
Yeah.
one thing, I mean, as an agency owner that focuses primarily in the space, I see exactly why you did what you did on building the dashboards, the tracking numbers. Like, you have all the data, and just thinking of outcomes. Like, how many people a year? Is that one of your numbers? Like, we've helped X amount of people, million people, find the treatment centers that they're looking for at the time they need it.
Man, yeah, I think in terms of growth goals is getting
7 billion served.
getting better data on that, because you have to really close the loop on so some of our treatment centers are really good at reporting back to us like how many admissions they got, and then I'm sure you can imagine some are really bad at that.
Well,
we do track that in terms of the ones that tell us, and actually we use as like social proof on the website, which I think goes back to that patient first side, is like we'll say, 4 people got help here recently, and because we're like someone actually told us, this treatment center told us, someone called, they came and got help here. So I think using that as social proof is really helpful for people that come to the website.
Yeah.
You see that in a lot of other marketplaces, just you go back to the Airbnb, these people, this many people booked in this city or whatever recently, that type of thing.
From your perspective, what's the nature of that relationship between recovery.com and then a provider? So do you actually staff that with like an account person, or do you really rely upon that? You rely upon the provider to be like, I'm going to be really aggressive and try to feed this information. So like, what's that pipeline look like?
Up until this point, we've been totally reliant on our account managers. So we have a team of account managers. Anyone that's advertising with us gets an account manager assigned to them. We actually call them performance managers because they're mostly essentially managing the advertising campaign, which is a nice value add for, if you think of a Google campaign, you have to staff. Someone has to manage that campaign, whereas managing a campaign on recovery.com is a lot lighter lift because you have a team helping you with it. But then we are actively rolling out a more of a portal experience that will allow us to kind of push for that information through that versus, we'll still do a lot kind of more of the concierge approach, but it's not as scalable as we'd like it to be. So I think that portal is going to help a lot.
I think from an agency standpoint, showing if you can connect the attribution, is going to be the gold mine.
Yeah, and so we have, a growing channel for us is our agency channel. So I think about 30% of our advertising is basically managed by agencies, and so we work with a lot of treatment centers directly, but these agency partners that we work with, it's really a strong, Signe is sitting here watching, and she's heads up our agency program, and that's been really cool because we started working with we just kept running into basically a lot of the same agencies where we're like, oh yeah, you're working with this client, and so we started kind of more intentionally partnering with them, and so that's been really helpful because then we can we kind of know what type of clients are going to perform really well, and we can give them that information, be like, oh, you should really bring on this client, and then the real benefit with working with the agencies is that they tend to have I probably can't swear on this, but they kind of have their stuff together, in terms of they're
that's Midwest nice there.
Yeah.
It's like we're PG-13.
Yeah. But they're especially on the attribution side, that can be a really gnarly problem that a good agency has solved a million times for their clients, so we can normally trust the data that we're getting back.
The problem with the agency world is that they can only solve this is SEO versus PPC versus social. They have failed, in my opinion, trying to crack the nut of what's business development, alumni. That's where
a whole nother.
That's a whole other conversation.
If recovery.com could help figure that out.
Thanks for telling us a lot more about recovery.com. You guys are doing great work.
Thanks.
And you're really getting a lot of people into the place they need to be at the time. And I also wanted to give a shout out to Signe, who I know came in today, but we talked to her last week, and man, she's amazing to work with. Gave a great explanation for your agency partnership program, and so I appreciate all you guys are doing. Is there anything we didn't ask you before we wrap up?
Yeah, the whole list of questions. But I love it. This was a good conversation.
So Ben, I've got the most important question.
Yeah.
Will you come back if we invite you back?
Oh yeah, definitely. This was fun. I'm glad we got to do it in the studio too. It's hard to replace that.
Now, how long are you in Nashville? You're staying through the week?
Yeah, just for a couple days.
Okay.
We're staying at the Gaylord.
And you guys, because you guys do a lot, and we appreciate, the field appreciates, your generous sponsorship with all the events and conferences. But you'll be at West Coast. Mm-hmm. You'll be at Lone Star Collective.
Someone from our team. I won't be at Lone Star, but yeah, I'll be at the NAATP National.
Okay. Yep.
All right. Yeah. So I mean, I do think that's actually a big part of how we've built our reputation over time. Is just showing up. And many people know us through Rob Schuler, who, he used to run operations way back in the day at Duffy's, which was like one of our big behavioral health clients. So we immediately, when we first hired someone to start doing our business development, we're like, let's hire Rob. He's been in the field and he has a great reputation. He's the handlebar mustache.
I just gave Rob
know.
One of my Army Challenge coins. So
he told me about that.
Yeah, good guy.
Yeah. So we have a lot of people that are either in recovery or just really understand the space and how important just building that reputation is over time. So conferences are a big part of that and showing up for those. I was at the Winter Leadership Summit last month, which if you like skiing, it's amazing to have an excuse to I have to ski for work. It's great, but it's this huge recovery leadership conference is really inspiring. So yeah.
Well, Ben, we'll see you down at the NATAP conference too. So we're bringing the MasterMined studio down there to do some podcasts live there off the floor. So,
cool.
Yeah.
Awesome.
Thanks for all you do in the industry. Thanks for
Field.
Good call.
But I like the way
catch.
Mark says industry. He says industry.
Yeah.
Industry.
Yeah.
So maybe that's
I grew up in the Midwest too, so hey, it's the dialect, right? But
Mark, you got to put the right emphasis on the other syllable.
You're right.
I do like that. Yeah.
Well, that's a wrap for today's Mastermind. Thank you for joining us on behalf of Lee, Jeff, myself, and the entire MasterMined crew. We really appreciate you showing up week in and week out to hear from industry professionals as well as Jeff and Lee and myself on some OG episodes. So if you would, please rate, review, and subscribe to our podcast so that we can get this message out to more people. Thank you. And if you have any questions for Ben about recovery.com or anything the future of what they're building, please put it in the show comments and we'll get those over to Ben to get answered for you. Thank you. And until next week, we'll see you on MasterMined.
That wraps up this episode of MasterMined. Thank you so much for joining us. And remember, MasterMined is not just a podcast, it's a community. So don't forget to comment, subscribe, and review us. Your feedback helps us continue to bring you content that's relevant and relatable. Thanks again to our sponsor, Snapshot, a digital media marketing agency. And thank you for joining us on MasterMined, your behavioral health playbook.